Well, good afternoon, Dr. Smith. We're really excited to be here with you today. I want to introduce you to Dr. Michelle Smith, who is the Chief of Neurosurgery for Mainline Health, the Co-Medical Director of the Neuroscience Service Line, and Associate Professor of Neurosurgery at Jefferson. So welcome, Michelle. We'd love to get to know a little bit more about you and how your career has progressed in the world of neurosurgery.
Thanks so much, Erin. It's so great to be here with you. And I know partnering with you guys with brain aneurysm awareness has been incredible. And it's something that I'm also very passionate about. The first time I ever did surgery in the operating room, I think you either love it or you hate it. And I was so enthralled with what I saw, with what was going on there, and never expected to want to be a surgeon. But the moment I did it, I said that this is my calling. This is what I need to do. And also I was always interested in the brain. At Cornell University up in Ithaca, New York, I was a neuroscience major. The first time I ever had the opportunity to observe a brain surgery, it seemed like the perfect melding of my interest in neuroscience and being a surgeon. The interesting part was, so at the time I was a medical student at University of Pennsylvania, and such an incredible crew there. And I remember being an early on medical student, and I walked up to the attending and I said, "Are girls allowed to do this?" Because there were almost no women that I saw in the field. All the trainees and other med students interested were all men. It's a little different now, and they chuckled a little bit and they said, "The right women are do this. So come to us if you're interested." And that was the moment. On from there, they became my mentors. I actually took a year out of medical school just to do research with the neurosurgery department, and it reinforced what I wanted to go into.
You touched on your approach to counseling and developing a relationship with your patients so well. When patients are leaving the care of the hospital or moving on to rehab, what are your words to them when they're kind of leaving your care?
My first words are, congratulations. and you are so amazing, because this is hard. This is really hard, and when you go home, people are going to look at you and they don't see a big scar. They don't see that we shaved half your head. They, usually again, it's a tiny puncture mark here that's healed up by now, but this is a big deal. So you're going to need to take it easy for at least the next 1 to 3 months. We talk about what that means. What does it mean to take it easy? I have a lot of patients who are moms, often, rupture patients, often more women than men, in the prime of their lives. So they're professionals and they want to get right back to it. And we talk about, you are going to get right back. You're going to get back to it, but you need to let your body heal. So, and the other thing is, inevitably, if people have done really well, no issues with, infections, vasospasm, any of the things that could happen, need to get shunted from hydrocephalus. Even if you got off scot-free from that stuff, you're not going to feel back to your normal self for at least 3 months afterwards, at 90 days. So we just talk about that expectation. And you come back to see me in the office at the 4-week mark, sooner if you need it, but at the 4-week mark, where we're again rehashing this stuff, checking in. But I let people know, usually at the 4-week mark, that at 3 months, people tell me, I feel like a cloud is lifted. I finally have some of my energy back. I feel like I'm not in a fog anymore. My short-term memory is starting to come back, but it takes time. One of the most important things that has helped me get through is my own personal mantra of, I don't want to be a woman in neurosurgery. I want to be an exceptional neurosurgeon, period. So the things you do for that are a little bit gender blind. But you have to be gender aware. You have to be not naive to, maybe there's something going on that I'm missing here. Maybe it has something to do with being a woman, even on a subconscious level, modes of communication.
Right.
So it's important to be aware of that.
Michelle, thank you for your time. It's always inspiring to talk with leaders in neurosurgery in the field. And we're really excited at the B Foundation to be working more with Mainline and Jefferson and the broader team. So we just really look forward to collaborating further.
We're really, really excited to be partnering with you guys too. And, it's only in the recent past that I found out the B Foundation. I've known about it for a long time, and as a very strong national organization, of a topic I'm super passionate about, and only recently found out that we're local here. So we're really excited to partner with you guys.